to update the professional of PT, and we'd like to welcome Dr. Khan for coming and giving us this valuable presentation. Dr. Khan is going to give us a presentation about the scientific breakthrough treating degenerative and chronic pain by the KKT. Dr. Khan is the founder of the KKT internationally. He graduated as a chiropractor in 1991, continued into his private practice as well as extensive studies in orthopedic medicine. He focused on pain management and rehabilitation, anti-aging and hormonal intervention to prevent degeneration. He also helped in founding unique non-surgical KKT orthopedic spine centers in Europe, Middle East, Southeast Asia, and China. Dr. Khan has established Optima Health Solutions internationally and is a founder plus president of International Centers for Spine and is a long-standing member of the American Association of the Orthopedic Medicine. He has published several peer-reviewed scientific papers on the topic of the impact of the KKT treatments. He is frequently called upon as an expert witness due to his deep appreciation of the subject of pain association condition related to the skeleton and the nervous system. Dr. Khan, we're most honored to have you, and we welcome you to please start your presentation. Thank you.
Thank you very much for coming here today, and for me as well, it's an honor to be here at your institution, and I'll tell you the reason why. For me, it's been my own lifelong objective to not only discover but also help in educating physicians and clinicians around the globe, and it's been a big part of my life. So much so that I've dedicated certain amounts of time every year that I give only for educational purposes. And to see all of you taking the personal interest to come here today, and for your institution to dedicate time for continuing education and updates, I think it's a remarkable show of concern for the medical field itself, and for the betterment of our patients at the end of the day. So I really want to commend your institution and all of you for being here. I have my personal interest has been also in the health and well-being of patients in the Middle East, and it's been something that I have gravitated to because being in the US and in Canada from my childhood, I would see a lot of patients coming to that part of the world for treatments. So in my work in the Midwest, in the U.S. Midwest, I would often go to, get involved in the Mayo Clinic in Minnesota, and of course, it used to be full of patients coming from this part of the world, and similarly in other institutions as well in the U.S. And it used to always trouble me that why do they have to come here for this treatment, for any of these treatments, when there are such qualified people in the GCC and in the Middle East generally. And there is such a historical proof and fact of clinicians being created and being educated for centuries in this part of the world. Why all of a sudden do we have to send all these patients coming over there? And in some cases, of course, we can rationalize it and say that it's because, we have new advances, technology, but I think it's more than that. I think, there has been a little bit of a shake-up in the confidence of the patients in many cases. Some of it for the right reason, and for some of them, they're not correct. To question the clinicians who work in this part of the world. And you will see from my presentation that I'm not shy to talk about what this part of the world has delivered to medicine in the world generally. And why, and I give this presentation irrespective in every corner of the world, in Europe, in America, and the reason in Southeast Asia, the reason why I give this presentation, because these are factual points that I bring to the attention of our audiences, and especially those who are the educated groups, that the Middle East, and particularly the Arab world, has given a lot to science and to medicine. And I think you need to appreciate it and talk to your children about it. You know, I'll touch on it a little bit today, but I'll give you a little bit of background into why I speak about it, and in the way that I do. Today, thankfully, you know, we've made immense progress in treating conditions, particularly chronic conditions, which have been very difficult in the past for us to manage. Particularly, as you know very well, dealing with chronic pain, dealing with degenerative conditions, it's a challenge. And it has not been well treated or managed. All the attention up till now in medicine was on diagnostics. So whether it was MRI, whether it was CTs, whether it was ultrasound, whether it was all of that. And the reason for that was because for a lot of the institutions and companies, this is where they could see the upside financially. But in terms of treatment, they've been very limited, extremely limited. So they have been, whatever has been done is being recirculated again and again. So when for example, for decades, do I need to adjust the speaker down or up? So in the case of, for example, as you know very well, let's say, for example, in traction, when it comes to treating with traction, it was happening for centuries. It was nothing new. All of a sudden, a few years ago, somebody came up with a machine to traction, you know, and they put some lights on it and did some, you know, fancy, you know, some fancy engineering on it, and then all of a sudden they reintroduced it as decompression or whatever it was. It's nothing new. It was an old technology that has been recirculated. And so in our case, and then of course, you know, it was being repackaged that way, was all that was being done. But in terms of actual breakthroughs, there were very minimal breakthroughs in medicine to treating particularly neuromusculoskeletal conditions. We know what we've been, you know, whatever had been developed, let's say pharmaceutically, we have huge questions around it. You know, whether it was even in the simple form of using analgesics, like acetaminophen, or whether using anti-inflammatories, we see the huge impact, the negative impact of it today. Acetaminophen, you used to think it was harmless, paracetamol and all of these things, and Tylenol. But we know and we appreciate there are huge risks associated with it. Ibuprofen now has been proven to affect, you know, has been shown to influence cancer, oncogenes. You know, and of course, if we go into strong anti-inflammatories, the immediate apparent results on the body are well known to us. So, you know, in effect, we used to take one step forward and 2 steps backwards in some cases. And that has been a very big challenge. So for us, you know, thankfully, when I started my journey in KKT about 17 years ago, or even earlier, and when we started to discover the findings and the outcomes of the patients, for me, it was a very exciting time because it was a true break from the normal. It was a clear break, and it was a very distinct approach to treating the body that had not been done previously. But for the sake of our discussion today, I'm going to show you a presentation where I will explain to you some of the past things that were done that were similar. Similar, like you would say a bicycle and a motorcycle. But still there are similarities. And I think it's important to touch on that. And so I'll go through this. Now, let me tell you that this presentation that I'm giving you is a very long presentation. It's a week-long presentation, weekend-long presentation for 2 days. I'm going to compress it and shrink it for you so that I'll do it in a matter of 1.5 hours to complete as much as possible. And so I'm going to skip over a lot of material, and I'll leave that possibly for next time when we meet and when we talk again. But for today, I'll try and go through as rapidly as I can, and in case I miss anything, you'll have a chance to ask me some questions later. But I think if I can cover the major materials here, I think it'll give you a very clear sense of what we're doing here. These are all the points we would cover normally. I cannot go through all of that, but I will discuss with you a little bit about the application of the waves, the KKT waves. In my case, very specific to what we do, they're sinusoidal, and so I covered a little bit here of the work by Albert Girard on how sine waves have been used to influence energy production and how that has medical applications. I'll cover that as well. And you'll see that in all of my text here, it goes back, the sinusoidal wave has very clear links back to the Arab world. They come from the Arabic texts. We cannot remove that. Those are facts. I cannot alter that. And so this is very clear, and they go back to the very beginnings of our time. And of course, I don't have to go over the sinusoidal wave and what is required in there. Of course, today, things like when people are using some of the cold laser therapy, if you're familiar with that, they use some components of energy and sine waves as well. This is some of the physics. I won't go into that as well. I'll skip over all of this material and then I'll go into some of the rays and how. So, of all the energy forms that our body is designed for, the ones that are the most riskiest to us are the high frequency waves. I'm going to repeat this, and you can always bank on this in the future. If there's one thing you want to remember, particularly as physios, whenever we go into high frequencies, whether they're in the form of cell phones, whether they're in the form of other waves, any format of waves, the higher the frequency goes, it appears clearly now that the more damage there is to the body. Now, we are using some of that damage, for example, in laser, when we do surgeries, in orthopedics and in neurology, we would use that in order to burn out or size or do different things with it. But there is no question that the damaging effect is the effect on removal or causing direct trauma is very real whenever we go into high frequencies. And it is believed today that it is the high frequencies, even the ones that we're exposed to every day, that cause the damage through the outer cellular wall of the cells. So the cell wall, as you know, is very delicate, and that appears to be damaged whenever we apply high frequencies to the body. Now, that also, the next thing I'm going to mention to you is a discussion point. We're not confident on this yet, but we believe that what happens when it hits the outer cellular wall is it causes leakage in the cells. And in the long run, it causes things like inflammatory reactions and so on and so forth. But a lot of those things are believed to be directly related to the high frequencies that we are exposed to today. And this is showing the Hulk and the gamma rays, the effect of that. And I'm also showing, here I'm just showing you some very simple sinusoidal frequencies that we come across every day, when in our day-to-day life. These are all the same waves. This is, of course, looking at the orbits of the planetary motions. So how the planets move next to each other also takes on a bit of that sinusoidal wave pattern. And of course, you're very familiar with the oceans. These are well documented, and we know what the power of these waves are and how they can, they can entirely annihilate the globe as we know it. And these are all based on sinusoidal wave patterns. We know now that using sound, we're able to influence the body in many different ways as well. We're using them to physically move things now, so we can use sound to move things. And all of those of you who are old enough, I don't know if you remember or if you ever were exposed, but there used to be, this woman who used to sing, Aretha Franklin, and she used to sing, and they would do an advertisement where she would be singing and there would be a glass, and it was an advertisement for Memorex. You remember the old cassettes from Memorex? If you're my age, you would know it. So then they would play it, and as soon as she would hit the tone, it would break the glass. And then they would play the Memorex, and it would break the glass to show it was identical. So that is how we appreciated that these waves had a very direct influence on the body. It was a very early on, sort of understanding of it. Of course, whenever we hear music or sound or speech or whatever we hear, there is a direct impact on the body. And in our case, there's a movement of the tympanic membranes, right? It's a very simple way that I'm trying to explain how sound influences us in a physical way. And when it is applied, what we see is that there are very distinct patterns of sound. So for example, when we apply it into water, we get these patterns that are created. They're very real and replicable patterns that are created whenever we apply these sounds. This is the sound of a whale or a dolphin when it resonates sound underwater. It takes on this shape in the oceans. And similarly, you'll see the symmetry in all of these things. They're identical, and they can be recreated. I don't know if any of you have ever heard of the term cymatics. Can you put your hand up if any of you have heard of the term cymatics? Well, I'm going to have to tell you a little bit about it today, and I think it's extremely important for you to remember this, okay? Unfortunately, like I said, we have very little time today. It's not a program where I can really teach you and train you, but cymatics, for anybody involved in medicine today, is very, very important. It's extremely important, and particularly on the physical medicine, the rehab sector. It is extremely important for us to know what it does and what it stands for. What you're seeing here is a picture done by a fellow by the name of John Reid. He was a very sharp man in the U.S. that started to capture how sounds influence, how they influence patterns, and how sound can influence the body as well. And so this is his work on cymatics. And you'll see these stunning images from his work. I'm going to need to show you that. Yeah. It's the first one.
This one?
Yes. Yeah, I'm just trying to catch it on here so they can hear it. going to stop it. It goes a bit long. But I wanted to give you an idea of what happens here when different frequencies are applied. You know what? When that happens to salt, it just doesn't happen to salt. It happens to us as human beings as well. Whenever frequencies are applied to our body, they directly influence our tissues. And this influence is not only just superficial. In our case, as I'll explain to you with KKT, we're able to influence the genes of the body. We're able to influence gene expression by sending it the very, very precise waves. And so I'll walk you through a little bit further. So John Stewart Reid, he's written a lot of books on this topic. And he used a cymoscope in order to be able to identify and be able to measure these features. He was very gracious enough to allow me to use all of this information when we would initially have our discussions. So we talked a lot and we covered a lot of material together in our initial days. In this case here, what you're looking at is the sound that is created when a female, when she utters the word you, it looks like that on our bodies. And similarly, this is O, and this is A, this is the vowel I. So I'm giving you, various sort of components of this. I'll have to skip through a little quickly. This is a wave that was a feature that was created when sound is passed through water. So as it passes through a liquid medium, it creates this type of a shape, which is a hexagonal shape. Now the interesting thing is that this shape is exactly the same. It's a hexagonal shape that is formed also in the planet Saturn. So Saturn has the same hexagonal shape. And this is John Stewart Reid in his initial days. And I'm just going to be skipping through a bit here. This is the Fibonacci sequence. I won't trouble you with all of that, but this is all the mathematics that goes into how these shapes and how these patterns develop. I won't